Hey, guys. So good afternoon. Today we're going to be detailing plans for the next phase of our COVID-19 vaccination plan. This will be individuals living and working in congregate care settings. We're also joined by Amy Shackman, who's the president and CEO of Two Life Communities, and Diane Gould, who's the president and CEO of Advocates, to speak more about how their organizations plan to participate in the vaccination program. Just want to give a quick update on the Commonwealth's COVID data. Yesterday, the Department of Public Health reported 4,906 new cases. 69,982 new molecular tests were reported. There are 2,219 patients in the hospital being treated for COVID, and 451 of those are in the ICU. Last month, as most people know, we began vaccinating the first healthcare workers here in the Commonwealth. Since then, over 156,000 doses have been administered to healthcare workers, including in some cases first and second doses. Next, we began long-term care vaccination programming for elderly residents and staff, which is administered by CVS and Walgreens. By the end of this week, all skilled nursing facilities in Massachusetts will have had their first vaccination clinic with either CVS or Walgreens. On Monday, we started vaccinating first responders here in the Commonwealth. We stood up 119 vaccination clinics in partnership with local health departments and have seen terrific response to this in the first few days. We also announced the first mass vaccination site, which will be at Gillette Stadium, which will scale up to administer at least 5,000 vaccines a day. In total, 177,125 doses have been shipped to Massachusetts, including 347,450 doses shipped to providers and 129,675 doses provided to pharmacies as part of that federal pharmacy partnership program. The Command Center and the Department of Public Health are working closely with providers and stakeholders every step along the way to develop plans on how to safely and efficiently distribute vaccines to those who need them most. Distributing vaccines to our residents can't happen fast enough, and we've made enough progress with our frontline healthcare workers and long-term care residents that we're ready to start inoculating the next group of residents. And today we're announcing the details for residents and staff in congregate care facilities, including residential facilities, shelter programs, and corrections. These facilities are prioritized because they serve vulnerable populations in densely populated settings, which means they're at significant risk for contracting COVID-19. The staff are also high risk for exposure at these facilities, and many of them do amazing work, and it's important that they're vaccinated to protect themselves and their families. This includes over 94,000 eligible individuals across Massachusetts, and these vaccinations will begin on Monday, January 18th. As a programming note, a handful of programs in this group have already done their paperwork with the federal government and started administering first doses through the federal pharmacy partnership program with CVS and Walgreens. For all other congregate care sites, which is about 3,500 locations plus corrections, we've been working with providers to set up different vaccination options. Congregate care sites include residential congregate care programs, group homes, residential treatment programs, community-based acute residential treatment programs, and clinical stabilization programs. Shelter programs, including homeless shelters, domestic violence shelters, and veterans shelters, and approved private special education schools. For these programs, they have three options with respect to vaccinations. First, organizations can self-administer vaccines if they meet the guidelines that we posted back in December, including demonstrating that they plan to vaccinate at least 200 individuals. Second, programs can leverage existing pharmacy or provider partnerships that they already have to vaccinate their staff and residents for flu each year. This is a good option for programs that already have existing relationships with local hospitals, healthcare practices, community health centers, university health centers, or visiting nurse programs. Or number three, sort of like Donna White, is that who's the one that does you got that? Door number three, Mass vaccination sites can also be utilized, and the first one obviously will launch at Gillette Stadium on Monday, and we expect to announce additional details for other sites soon. For more details on this, you can please visit mass.gov/congregate care vaccine. Correctional facilities will follow a different process, and Secretary Sutters will talk about that in more detail. Vaccines for these facilities will also begin next week. There are about 6,500 inmates and 4,500 staff at DOC facilities, and we expect inoculations there will take about 3 weeks. For houses of correction that are run by the sheriffs, there'll be a similar process with their medical providers administering vaccines there. Before I close, I do want to mention that later today we're going to refile the legislation that we filed toward the end of the last session to ensure solvency for our unemployment system and to provide relief for the Commonwealth's employers. As we said when we initially filed the bill last month, the sheer volume of unemployment claimants due to COVID-19 automatically triggered an increase in unemployment insurance rates for employers. That's why we want to freeze UI contribution rates for employers, which will provide immediately relief for local businesses across Massachusetts. Though we've already entered a new year, this bill would allow us to charge employers the lower rate retroactively. Secondly, we want to enable the Commonwealth to issue special obligation bonds to repay the federal funds that we received this last year to keep the UI trust fund solvent. This will save money both for the Commonwealth and for employers to ensure that we can continue to pay unemployment benefits to those who need them. And while we wish this legislation could have been passed before the end of the last legislative session, we're committed to providing this important relief for employers early this year and to ensuring the solvency of the UI Trust Fund. To ensure that we provide timely relief to employers, we're going to continue to urge the legislature to act on this bill by early March, which is when rate notices will be issued, and we look forward to working with our legislative partners to get this done before that. Let me just close by saying that I think everybody knows that establishing a vaccination program of this scale, which has never been done before in the U.S., is obviously a complicated exercise. And as we move through the priority groups, our administration will continue to work with stakeholders to provide detailed information on where and when they can get vaccinated. We've made a lot of progress so far. We've administered over 239,000 doses and scaled up to over 100 vaccination sites. The groups that are at the most risk of contracting COVID, healthcare workers, long-term care staff and residents, and first responders, are being vaccinated. Many of them already have. Our administration is working around the clock to ramp up this distribution process and to make sure we have the infrastructure in place to administer these vaccines as they come to us. Vaccines are obviously a critical part of getting back to normal, but we still have to hold on a little while longer and do the things that we know work. I know I sound like a broken record on this stuff, but it's critically important, especially with the new variant here in the U.S. that's far more contagious than the very contagious original COVID-19, that people wear face coverings when they're not in their homes, that they don't hang out with a lot of people they don't live with, that they keep their gatherings small and short. If you're going to be gathering at all, it's best to do it outside rather than inside, and try not to spend a lot of time outside your house. The people of Massachusetts, as we all know, have made tremendous sacrifices throughout this fight against COVID. And while I think we can all agree that brighter days are ahead of us, we still have a long way to go, and everybody's got a role to play in continuing this fight. And I'm sure people of the Commonwealth will be up for it. And with that, I'll turn it over to Secretary Sutters, who can talk a little more about some of the details.
Governor, Lieutenant Governor, and delighted to be joined by Amy Scheckman and Diane Gold. Good afternoon, all. As we forge on into the Congregate care vaccinations, we're working with providers to ensure they have feasible options available to vaccinate their residents and staff. Every public agency has a point of contact that is posted on our website. Our agency points of contact are working directly with the providers to ensure all congregate care and shelter programs have feasible and realistic vaccination plans. Last week, we held a webinar to support our provider community. More than 800 individuals participated. Following the webinar, we sent out a brief survey, and I mean brief, to ensure that all providers have vaccination plans and to identify providers that need more support to develop their operations. Across the Congregate Care programs, our providers are leveraging existing capabilities and existing relationships wherever possible. Some programs, you heard the governor describe the three options. Some programs have the clinical capacity in-house to order vaccine directly from the Department of Public Health, and where possible, we're working with providers to allocate the vaccines directly to them. Some programs have strong clinical partnerships that exist with a provider or pharmacy. For example, from operating on-site flu clinics every year. Where these partnerships exist, we will allocate vaccine to the clinical partner directly for the program. Our programs can also use the mass vaccination sites, provider-operated vaccination sites, and pharmacy sites as they come online. There's a map of vaccination sites posted on the website. We will be adding sites to the map on a rolling basis, so it's important to check the website. Our Congregate Care providers and residents will be able to book appointments at the Gillette mass vaccination site starting on Monday. And as you heard from the governor, the site will be ramping up to 5,000 appointments per day. Of the more than 3,500 Congregate Care sites, approximately 1,500 individual Congregate Care sites were matched to the federal pharmacy program. We are working with each provider on the entirety of their Congregate Care and shelter site lists to make sure that every provider and every site, whether they were matched to the FPP or not, has a vaccination administration plan under development. Our programs have different clinical capacity, partnerships, and serve residents with different needs, which requires us to employ a range of strategies. One size does not fit all. Further, as the governor indicated, vaccination at correctional facilities will begin next week, once the facilities receive the vaccine shipments. Inmates and staff will both be receiving the Moderna vaccine, and obviously it's voluntary. Department of Correction inmates will receive their vaccines from WellPath clinicians in the facilities. The Department of Corrections has a long-standing relationship with WellPath, and so that will be their provider. We're also using Armstrong and Brewster ambulance staff to augment the need. Houses of Correction are leveraging their existing clinical capacity and will also receive the vaccine directly next week to vaccinate their inmate and staff. One additional update. In order to further protect vulnerable populations and ensure equitable distribution of the COVID-19 vaccine, today we're announcing an addition to priority groups included in Phase 2. And that is public and private low-income and affordable senior housing are now prioritized in Phase 2, Group 1. Phase 2, Group 1 priority includes individuals with 2+ comorbidities, individuals age 75+, and now includes residents and staff of public and private low-income and affordable senior housing. Similar senior facilities that are part of the HUD 202 program are already receiving vaccines through the Federal Pharmacy Partnership as part of the Phase 1 of the plan. So this change brings the timetable for other similar facilities more in line. This change will ensure that the approximately 160,000 residents and staff of public and private low-income and affordable senior housing will be able to receive vaccine once Phase 2 begins. Guidance for public and private low-income and affordable senior housing has been posted on the website. The guidance document provides further clarity around the types of housing that are included. A few examples. Public housing properties designated primarily for older adults that are owned or operated by local housing authorities. This includes those public housing properties owned by a local public housing authority but managed by a private company. It also includes privately owned properties designated for older adults that are financed in whole or part through resources made available from DHCD, Mass Housing, or the U.S. Department of Housing and Urban Development, and which the majority of units are restricted to residents earning less than 80% of area median income. More details on the vaccination options for this group will be available in the coming month as we finalize plans for Phase 2. As the governor said, joining us today are two presidents and CEOs, and I'm going to first turn this over to Diane Gould, who's the president and CEO of Advocates, Inc. Diane?
Thank you, Secretary Sutters. Again, I'm Diane Gould. I'm the CEO at Advocates. We are a nonprofit human service organization based in Metro West with services throughout central and eastern Massachusetts. We serve people who have a variety of life challenges. They have intellectual and physical disabilities, autism, serious mental health conditions, substance use problems. Our mission is to help people live a good life in the community. Many of the people we serve live in congregate care settings, in group homes with 24-hour staff support. These are individuals with complex needs. Some of them have serious medical problems. These last months have been very difficult, and we are thrilled that the vaccine is here. We're participating in the Federal Pharmacy Partnership Program, working with both CVS and Walgreens. Pharmacy staff will be coming out into the group homes, the congregate care settings, to administer vaccines to both staff and people who live in these settings, beginning this weekend. And over the next few weeks, we expect that more than 1,100 staff and individuals working and living in these homes will be offered the vaccine. We are very excited about this plan, as are the families we support. In fact, we had a family forum just last night in which we provided education and answered questions, and to a person, family members spoke about their immense relief and appreciation that their loved ones would soon be vaccinated. All in all, this is going extremely well. It is a bright light in what has otherwise been a very dark time. We are profoundly grateful to Governor Baker, Secretary Sutters, and their team for their leadership throughout this pandemic, and especially now with this vaccine plan. Thank you.
This is just so great. I just have to start with that. And I just must start by applauding this administration for prioritizing residents and staff of subsidized senior housing. It's fantastic. I'm so grateful, but I can't say I'm surprised, because you have shown, since you started, a deep commitment to our Commonwealth's precious elders, and a deep commitment to creating and preserving affordable housing. So it's not a surprise, but it's fantastic. And thank you, Lieutenant Governor. Thank you, Governor. Thank you, Secretary. Yay! I'm so happy. This is just a really important milestone. For older adults living in subsidized housing, they face a double threat from COVID. By virtue of their age, more vulnerable to serious illness and death from the disease, and also more at risk for the dire consequences of social isolation. And by virtue of the incomes, the folks that live with us can't afford to purchase lots of technology and gadgets to maintain connections. So of course, Two Life Communities has gone to really extraordinary lengths to maintain these connections. With our computer lending center, our creating our own TV channel, regular phone calls, outdoor walking clubs, window concerts, and lots more stuff. And yet, people still are craving that kind of face-to-face interaction. That's a normal part. It's a daily part of life at Two Life. As one of our 94-year-old residents said to me, "This could well be the last year of my life. I do not want to spend it as a prisoner in my apartment, deprived of the interactions that make life worthwhile." Oof. So in case you don't know us, Two Life Communities is an organization committed to building a world where every older adult has the opportunity to live a full life of connection and purpose. We call it aging in community, and we do it by creating dynamic, supportive environments, housing, with a laser-sharp focus on affordability. And because we've been privileged to be part of the Federal Pharmacy Partnership Program, we've actually already begun vaccinating our 1,600 residents and 200 staff members, and it is fantastic. To make sure it's been successful, we've been doing a ton of preparation work. We speak to every resident individually in their native language, that's really important, to explain the process and to help fill out sort of complicated consent forms. We prepared public service announcements and other informational materials, of course, also in multiple languages to encourage people's participation. And we're making all the appointments for everybody and accompanying the pharmacy staff from door to door to door so that all they have to do is give shots and do the follow-up medical observations, and we do everything else. And it is proving fruitful. On Monday, we had our first clinic. We were able to vaccinate all of our residents and all of our staff at Shulman House in Framingham, 100% participation, 165 people in all. Right now, as we're right here, our second clinic is underway in Brighton. We've got more scheduled for Saturday and Sunday and every day next week and the next week. And there is so much joyous anticipation on all 5 of our campuses. We look forward to sharing everything we're learning with all of our colleagues in the affordable housing world to see if we can help their processes run as smoothly as possible. What we're most looking forward to is restoring community life. Yay! We're so ready. We're already planning like hundreds of activities. Of course, it won't be exactly the same as it was before for quite some time. We're still going to be wearing masks. We're still going to be washing our hands all the time. But for the people who have been so desperately waiting for the face-to-face connections, it means everything. So, yay! Thank you. Double thank you. This is fantastic. Thank you for getting us in all. It's really notable that you've included all subsidized senior housing. Thank you for getting us these vaccines so quickly. I promise it's making a huge difference.
Well, thanks, Amy. I kind of hate to follow that, but do you have questions for Amy or Diane?
Governor, the plan makes a lot of sense, but I think there's a lot of pushback among regular people about the inmates. Why should a convicted murderer sitting in Walpole get that vaccine before your elderly dad, my elderly parents, people with pre-existing conditions?
So we made the decision early on that we were going to focus on what we considered to be populations that were most at risk. And all the data and all the evidence makes pretty clear that congregate care settings are at-risk communities, no matter how you define them. And I remind people that there are 4,500 public employees who work in the state's correctional system who are every bit as much at risk as the people who are inmates there. And I think from our point of view, congregate facilities are congregate facilities, and we need to make sure that the people who work there and the people who live there, because of the possibility of outbreak and the issues associated with the heightened risk of close quarters and all the rest, that should be a place where we focus early in this exercise, along with congregate care facilities for people with disabilities, congregate care facilities for seniors, and other congregate care operations here in the Commonwealth.
But since the inmates can't leave, why not just vaccinate the staff?
Well, if you don't, first of all, there are people who come in and out of those facilities who are not actually employers there or employees there. You have lawyers who come in and out of those facilities. You have, in some cases, family members. You have other advocates who represent the people who are in those facilities. And I don't think you can draw a bright line that says you're only going to vaccinate one half of a population and not the other, when in fact there are other people who do come in and out.
So if I could just follow up on that, if I understand correctly, it's all wrong.
Say again?
It's all voluntary for the prisoners.
Correct.
Do you have a sense of how many plan on taking the vaccine? And if it doesn't seem significant, what's the plan?
Well, first of all, we don't know at this point how many people will take it. What we do know is most of the folks who are in congregate care operations, whether they work in them or they live in them, have expressed tremendous interest in this. I think Amy's comment about the fact that so far in the first site they did, they had 100% participation. And Diane's comment about the fact that the family members associated with the people that she serves can't wait is a pretty good indicator that for those folks in particular who have seen what happens in congregate care facilities when this thing starts to run, I think there's certainly a heightened awareness. And while Massachusetts has done, I think, a very good job of managing outbreaks in our own congregate care facilities, we've had some outbreaks that have been pretty dramatic. And again, it moves, and it moves fast when you're in a congregate care facility. That's just a fact.
Governor, are we still on track for phase 2 starting when you thought it would be starting? I think the beginning of February. Are the other phases still pretty much on track?
If the vaccines arrive as they are anticipated to arise, and I said yesterday that we don't get a lot of long visibility into when the next doses are going to show up. If they show up when they're expected to show up, then yes, phase 2 will probably start at or about the same time we anticipated.
Governor, I'm hearing some.
Explain the lag time. We get a lot of questions. The lag time of the administering of the vaccine, and then do we have a percentage of how much has been administered so far of the doses, just in general?
I think
we run about halfway, or
I think the number's about 50%. But the thing to remember here is it's not like we did not get 400 and how many, I can't remember the exact number. Whatever that number was I gave you in my remarks, we did not get that on December 28th, right? This stuff comes in batches of like 40 or 50,000, 75,000 with a couple of days lead time on it most of the time. And we then work to fill in the distribution channel as they become available and make sure that they get used before they reach their expiration date. And every provider that's involved in storing this stuff is required to tell us if they have any issues associated with lost vaccine. And I mean, so far, no one has told us that they were unable to use the vaccine that they had.
Governor, is there any guidance?
I think Secretary Summers has explained the papers on that background. What is the reason for the lag time, the weekly report, or how much has actually been administered?
I think of it as basically a reporting issue more than anything else. I mean, hospital organizations, healthcare organizations, the provider groups that are working on this stuff, you know, they are doing the work that they're doing to vaccinate people, and then somebody at some point is going to take that information and load it into MIIS. But there has been a lag. We're not, and by the way, we're hardly the only state that has a lag between the point of time at which somebody gets a shot administered and the point in time when it shows up in somebody's database at the state level. That's true in many states, and it's usually a couple of days.
Governor, is there any
New
guidance?
Times are tracking sort of how we're doing compared to other states. And they say that we are above the national average in terms of how quickly we're administering the shots, but behind in terms of coverage of population. Are we middle of the pack here? Are you satisfied with that? What's your response?
So we have a protocol, and the protocol starts with life risk and healthcare system capacity. That's kind of where we drew the line when we established where we were going to start with this. And everybody who's in our targeted categories, one way or another, falls into those particular grids. The third piece of it was to make sure that we were dealing with equity questions as we developed those early points of access as well. Now, we're doing the best we can to stick to that because we believe that's the best way to be quote-unquote fair with respect to how this works. Start with the people that are most at risk. Start with the people who service the healthcare system that's so important to our ability to make sure we take care of people who get sick and deal with some of the issues around equity that have been so present in this from the very beginning. There are other states that have much broader criteria that they're using coming out of the gate on this stuff, and that's their call. But if you don't work in healthcare and you don't work in long-term care and you don't work in congregate care and you're 25 years old, in Massachusetts, we don't think you should be part of what I would describe as the most pressing categories for getting vaccines. There are other states that have different policies with respect to that.
But what about those over 65? I mean, they are recommended vaccinate those people? Any more thought about that?
We haven't actually received, there's been a lot of media about the 65-year-old question. We haven't received like a bulletin or guidance or an advisory from the CDC on this yet. Once we get one, we'll obviously give it to the group that Paul Bittinger chairs, which is the group that we've been relying on for guidance with respect to our own protocols, and follow whatever kind of advice we get from them. We did move the 75-year-olds up into the second category based on the feedback we got from Paul and his folks after we got the guidance from the CDC.
Governor, what's the guidance? Mass vaccination, second Western mass?
We're working with several folks. We now have what I would call a template that we developed with the folks at Gillette, and we are now in live discussions with folks in other parts of Massachusetts about using that template in other locations, and I'm hopeful we'll have more to say about that in a day or two.
Governor, any guidance about vaccinations for prisoners that might end up in solitary confinement or otherwise might not be with the rest of the population?
My guess is that everybody who's there is going to get vaccinated. Sort of everyone, yes, everyone will be offered. The decision about whether you take it or not is obviously up to people on an individual basis.
Governor, one thing I saw in Arizona was they have the football stadium opened up. They're doing it in the parking lots. It's quick. People drive through, you get the shot, show your credentials. And if there's a lull, anyone can drive up and get vaccine. And they're hoping to do 10,000 a day. Is that the type of thing you're thinking about for Gillette?
I really hope, and I know this isn't popular, but I really hope that early on we are able, with the vaccine that's available, to hit the populations for whom life is most at risk and for whom the healthcare system relies on and depends on to provide care. I do know that in a lot of states, people who are the same age as my kids have gotten vaccinated before people who are home health workers or healthcare workers or long-term care workers or long-term care residents or some of these other populations or people who have multiple comorbidities and over the age of 70. Honestly, I just don't think that's the way we should do this. I think the focus early on should be on those who have the most to lose or who are fundamental to our ability to take care of those who have the most to lose. And remember, if all goes according to plan and we do end up with the kind of distribution that the feds project will be occurring if you get out 60 to 90 days from now, then we could be in a position where many of the kinds of places that we're talking about with respect to vaccinating people could be running at a very significant clip, the so-called flywheel that I've talked about, and you could get into a lot of those populations that don't have any, me, the lieutenant governor, folks who don't have any of the criteria that are sort of fundamental to this thing.
So do you think eventually, once we get beyond the stage you're talking about, it could be like that, a big parking lot?
Yep, absolutely.
Drive through, quick, boom, boom, boom.
Yep.
Governor, you mentioned let's say you mentioned in September. Do you envision that being a 24/7 operation so that people could just drive in the parking lot at any time and get vaccinated?
I think that's certainly possible. It's going to depend on three things: staff, demand, and what the folks at Gillette or at one of these other sites believe they can accommodate.
Governor, you have a bill on your desk, climate change bill. I'm not asking you where you stand on it, because it's policy on that thing. How frustrated are you that you either have to vote it, approve it or veto it? How frustrated is that? Because there's word out in your administration that people are concerned about elements of the bill.
Every year, not every year, every 2 years, right? We come to the end of the legislative cycle, and And I get the fact that complicated issues play out in a variety of ways. I mean, I remember at the end of the first session, after we took office, we were all biting our nails over whether or not the energy bill was going to get to our desk before the end of the formal session. And it was incredibly technical and incredibly complicated, and because of the procurements associated with wind and hydro that were in there, as well as some of the other elements and the federal rules and all the rest, the thing had to be written in a very particular way, and the three chambers conversations about this literally went down to the last minute, and eventually the bill got to our desk and we signed it, all right? At the end of the session 2 years ago, we were back and forth with the legislature to the very end around Airbnb. We called the Airbnb bill. It was basically the legislation around home rentals and that type of thing. It came to us. We hadn't quite gotten to the end of the negotiation. We send it back amended. Now, they're not in formal session anymore. So at that point, we have to get everybody to agree on whatever it is we end up with. And we spent a ton of time working the thing, sort of offline, and then eventually managed to get a bill done that worked for cities and towns, that worked for the industry, and worked for the Commonwealth. And it passed in an informal session without a formal vote, because we could do that. But you can't always write the ticket about how this stuff's going to happen when you get to the end of the process. At this point, we have two choices. We can either sign the whole thing or veto the whole thing. I would prefer to play this game in a way that's more consistent, for example, with the way we played the police accountability legislation. But, kind of is what it is. And I get the fact that sometimes stuff just doesn't get there until you get to the end. But my point being, this is an unusual year with COVID and everything else. I mean, I can just swearing in the new legislature for this session, I got a little bit of a sense of how difficult it's probably been for the legislative leadership to manage debate and discussion in this kind of environment. Everybody was broken up into divisions. There's people on the screens. I mean, especially when you're thinking about the 160 members in the House. So, the fact that this thing ended up at the very end of the session, it just did. And like I said, in other sessions, we've been able to work our way through the margins and the edges of this. It was a lot more complicated this year because of the COVID stuff.
Are you going to sign it?
We're still reviewing it. We have 3 very big bills. You may have noticed we signed or vetoed all the simple stuff that was on our desk that was fairly easy to get through in a pretty short period of time. We still have 3 very big bills on our desk that we're still working our way through: the transportation bill, the climate bill, and the economic development bill. And we know the clock's ticking, and we need to make decisions on all 3 of them this week.
Governor, a lot of cases that are identified to a cluster, are being linked to child care. I'm curious what you have to say about that, whether that could mandate prioritizing those people who work in child care for the vaccine based on what the reports are saying.
We're working through the priority categories that we were provided by the committee that Paul Bittinger chairs, and we have continued to discuss the possibility of moving people on those lists based on sort of new information and have updated the guidance. And that's certainly one of the categories that is currently under discussion. And people have moved based on those discussions with the committee.
Any update on security with the veteran issue as far as national guard?
So there are 2 issues associated with the Guard. One of them has to do with Washington, and that's really the one we're focused on at the moment. We have had, and I would imagine this is true for many states, especially those on the East Coast, we've had an ask from Washington to support a fairly significant request for Guard personnel in our nation's capital, and we're currently processing that. But that's been the primary source of most of that discussion so far. We continue to talk to all the people who are part of this. We had a call this morning, the Lieutenant Governor and I did, with Secretary Turco and with feds and with our own people about anything associated with what's going on here. And the answer here remains that there are no, at this point in time, what we would call known or credible threats in Massachusetts. But we are talking about a request from DC with respect to Guard personnel supporting their efforts around the inauguration.
Well, Governor, can you...
Governor, last week after the siege on the Capitol, you said that you thought Donald Trump should step down as president. Do you believe now that, do you now support the second impeachment of the president? And how did you get from, the last week you did tell us how you think you should step down? But if you do support impeachment now, let's get there here.
I said at the time that I believed that Vice President Pence should be empowered to manage the transition to a new administration, and I continue to believe that. I also said that there were a number of means and mechanisms that were available to deal with that at that point in time. Since then, several have been taken off the table, and the only one that's left at this point is to move forward with an impeachment proceeding. I still want Vice President Pence to be worrying about the day-to-day between now and the transition and anything that might have to occur after that as the two administrations try and figure out how to make these handoffs, especially the handoffs around all the stuff associated with COVID, as clean as possible. I mean, just spend a minute on the COVID thing, okay? Guidance from the CDC about various populations. All kinds of vaccines that are currently in process to receive an EUA that don't have one now. AstraZeneca's in there, J&J's in there. We have a long discussion that's been going on for a couple days now between the White House and the task force on COVID with states and with CVS and Walgreens around distribution plans. And this whole question about whether you go all in on everything you've got and just assume you're going to have second doses available for people when you need them, or continue to pursue the policy that's been pursued up to this point, which is to make sure they hold on to enough vaccine so that they can guarantee they can deliver a second vaccine in the 21 days or 28 days that are required. These are really big issues. They're really big decisions. They're going to last way beyond January 20th. And you talk to anybody, any governor, and I've been on a bunch of calls with governors on this, or you talk to any of the folks in the health and human service world or any folks in the healthcare world, they want that transition to be as seamless as possible so that people can plan and be able to make sure that what they hear right up until January 20th is exactly the same trajectory that everything's on from January 21 forward. So from my point of view, anything that makes sure that we have a very clear and very precise and very organized and coordinated transition, especially around these issues, is going to be critical to dealing with what you all have talked about as the bumpiness that's been associated with this rollout in the first place, right? I mean, I don't want this thing to go from here to here in the course of a couple days because a new administration takes office, okay? We really need this transition to be as clean and as coordinated as possible, especially around all these issues that are associated with COVID. There's also a whole bunch of rapid tests that are also in the EUA process right now. Now, I have full faith in Rochelle Walensky to be a superstar in that position, but as I sit here, I can't remember if she has to get confirmed by the Senate or not. I don't know. I mean, so this is why I think it's really important that this issue be joined and dealt with.
Should President Trump get a chance to run for president again in the future?
Well, I didn't support him either time he did run, but the rules of the game associated with that are not something that, I make decisions about. I mean, my preference would be, obviously, for other candidates.
Thanks,
Can I follow up on the National Guard comment you made? I didn't realize Guard from other states were heading down to Washington. I mean, how many are we talking about from Massachusetts? And do you envision Washington being just like a armed camp?
I don't know anything outside.
How many are you asking for in Massachusetts?
A few hundred. So I don't know what the rules are with respect to what might be coming or what the expectations are for other parts of the country. And remember, sometimes when they ask for very particular kinds of Guard personnel who have particular skills and experience, and that usually means that they take big numbers from some places where they have the kind of people they're looking for and not so much from others. So you really shouldn't generalize whatever the Massachusetts ask is to everywhere else, because that just, it doesn't work that way.
If we needed them, we could say no.
Pardon me?
If we needed them, we could say no.
Correct, but, honestly, a number like that in the grand scheme of things is, we're processing the request, but it's an eminently manageable number. Thanks.